Hi everyone, it's Donna Brooks here from Original Body Wisdom with more breathing tips, breathing for your life, but also helping COVID-19 because we know this disease has to do with oxygen and blood and getting oxygen into your blood. So I have a couple of things. One thing I want to talk about is how we tend to think that breath has to do with filling up and then letting go. And this idea of deep breathing taking a lot of effort and then dropping down. But really, in terms of our lungs expanding and contracting, what you want to feel like, I love this picture. It's an old picture. It's from the Breathing book by Donna Ferry, quite an older book. But the blue arrows are going to show you the directionality. So that's the back of your body. Here's the front of your body of your chest on the inhalation. So notice how it's more about width and expansion to the sides. Also in the back, it's more about width and expansion to the sides as you breathe in. And then when you breathe out, the breath comes more back towards the center. And I have a little toy here to help with that. And if you put this in front of your chest, so this is the movement of your lungs. There was an earlier video about the movement of your diaphragm, and they're both important. But this movement of your lungs, first of all, you have lungs here, right? Like at the top of your chest, everyone knows. But you also have lungs at your armpits. And most importantly, and really least thought about, are the lungs in the back. So all the way up to the top of your ribs, down even a little bit beneath your shoulder blades. So within your rib cage, your lungs create a lot of depth and dimension. So we'll breathe in and out, and if you've been following along with the videos about nostril breathing, please continue to nostril breathe. That also helps oxygen absorption, starting first with your exhalation. So letting go is really more important than taking in, right? Like you've got to clean out your sink before you can put new dishes in it. So cleaning all that waste that comes out of your blood into your lungs, carbon dioxide, used nitrogen, letting that go before you inhale. So letting a nice exhalation come out of your nostrils. And then when you feel a little bit hungry, a little bit thirsty for inhalation, see if you can breathe in, and as you breathe in, can you feel not just your chest, but your entire rib cage expand and then condense inwardly. So you're expanding and condensing, which means that you're looking for without strain, because this is all without strain. So my philosophy is I give you the anatomy, the actual functioning of the anatomy first. You have a picture of that in your mind, you tie it into a feeling, you're looking for the feeling. And then once you find the feeling, you don't need the picture anymore. You don't need the anatomy anymore. People who have good function of breathing, they don't need to look at anatomy books. That tends to not be in our culture. Our culture tends to be either very shallow breathers or belly breathers without the diaphragm, or chest breathing that expands and then collapses. But really, functional breathing in the lungs means your lungs are expanding out to the side and the front and the back as you breathe in, and they're narrowing towards center as you breathe out. So see if you can find that movement as you breathe. It will also help loosen all the little muscles. So between your ribs, both on the outside and on the inside, you have little muscles. And those little muscles should have enough elasticity for your rib cage to move easily as you breathe. And of course, sometimes they don't. And there's movement we can do for that, but there's also just the patience and practice of your own breathing that will create that elasticity so you can have an ongoing sense of expanding and condensing. If you want more information, go to my website, originalbodywisdom.com. I've got some tips. I have some online classes, and I offer one-on-one tutorials. Talk to you soon.